I'm Professor Steve Field. I'm Chief Inspector of General Practice, which includes dentistry. Dentistry is really important to me. It's just part of a larger primary medical services directorate.
I'm John Milne, National Dental Advisor to the CQC.
Over the last 18 months or so, we've been looking at dental care. We've been learning from what we've done as a regulator in the past, and we've piloted the approach in various parts of the country, and I'm pleased to say that we're now ready to go forward with the new approach.
Well, it lines up with the way the CQC looks at all services in health, and we'll be particularly looking at whether services are safe, whether they're effective, whether they're caring, whether they respond to people's needs, and lastly whether they're well led. We're particularly interested in the views of patients who use the service, so we'll be listening to them, we'll be listening to what staff tell us, and the whole idea of that is to make sure that we reflect in the process the views of everyone who uses services. The people who will be doing the inspection from the CQC point of view will be specially trained inspectors who are focusing on dentistry, and more often than not they'll be accompanied by a specialist advisor in dentistry as well. We'll be looking at about 10%, which is roughly 1,000 dental practices, and the reason we're doing it that way is because the previous experience of the CQC has been that dentistry presents perhaps a lower risk to the safety of the public than other sectors. The reason we're not going to rate practices is because if you're only looking at 10% of practices in year one, then 90% of practices have not had that opportunity, and it seems unfair to say to one practice, well, you're an example of outstanding practice, when others that may be equally good won't have the benefit of that being known.
Everyone in England needs a dentist. It's really important. Our job is to shine a spotlight on what's poor practice and make sure that we encourage improvement in that care, but also we want to celebrate really good practice as well. So this isn't a punitive system, this is really looking for care, making sure that we encourage improvement and celebrate the good. We want to work with all providers of dentists, whether you're a small general dental practice or a member of a larger group of dentists. What we're trying to do is make sure that we make dentistry the best we could possibly get it, and there's some fantastic dentistry out there across England, and we just want to make sure that wherever you are, whoever you are, you get safe, effective, compassionate dental care, responsive to the needs of you as a patient, provided by fantastic first-class providers. That's our aim, and we're very keen to work with you as a provider or you as a patient.